As we journey into our 70s and beyond, it's natural for our bodies to change. We might move a bit slower, have a few more aches, or find our energy levels aren't quite what they used to be. While some changes are a normal part of aging, it's crucial to pay close attention to our bodies and recognize when a change might signal something more serious. Sometimes subtle symptoms that are easy to dismiss as just getting older can actually be warning signs of declining health or underlying medical conditions that need attention. Ignoring these signs can lead to delayed diagnosis and treatment, potentially impacting quality of life and longevity. Today, we're going to talk about 6 important warning signs that people over 70 should never ignore. Our goal isn't to cause worry, but to empower you with knowledge so you can be proactive about your health. Recognizing these red flags early and discussing them with your doctor can make a significant difference in managing potential health issues effectively. So please stay with us as we explore these 6 key indicators. Knowing what to look out for is the first step in safeguarding your health in your later years. The first warning sign we need to discuss is sudden and unexplained weight loss. Losing a significant amount of weight without actively trying, meaning you haven't changed your diet or exercise habits, should always be investigated. While slight fluctuations in weight can be normal, losing, say, 5% or more of your body weight within a 6 to 12-month period without explanation warrants a conversation with your doctor. Many people might initially be pleased to lose weight, but unintentional weight loss can be a symptom of various underlying health problems. These can range from nutritional deficiencies, thyroid issues like an overactive thyroid, digestive problems that affect nutrient absorption, like celiac disease or inflammatory bowel disease, infections, diabetes, heart or lung disease, depression, or even cancer. It's not always something serious, but because the potential causes are so varied and some are quite significant, it's essential not to ignore it. Your doctor can help determine the cause through questions about your appetite, energy levels, other symptoms, and possibly some tests. Don't just assume weight loss is a good thing if you weren't trying. Treat it as a signal from your body that something might need attention. Our second important warning sign is experiencing frequent falls or a noticeable loss of balance. While anyone can stumble occasionally, having repeated falls or feeling increasingly unsteady on your feet is not a normal part of aging and should be taken seriously. Falls are a major cause of injury in older adults, often leading to fractures, especially hip fractures, head injuries, and a fear of falling that can ironically lead to reduced activity and further decline. Frequent falls or balance problems can stem from various underlying issues. These might include vision problems like cataracts or glaucoma, inner ear problems affecting balance, muscle weakness, nerve damage, neuropathy, often related to diabetes, arthritis causing joint pain or stiffness, medication side effects. Some drugs can cause dizziness or drowsiness, low blood pressure, especially when standing up, or even neurological conditions. It's crucial to tell your doctor about any falls, even if you weren't injured, or if you feel increasingly wobbly or afraid of falling. They can assess potential causes, review your medications, check your vision and hearing, and recommend strategies like physical therapy for balance and strength training, home safety modifications, or using assistive devices like a cane or walker if needed. Addressing balance issues proactively can prevent serious injuries and help maintain independence. Warning sign number 3 involves significant memory loss or increased confusion that interferes with daily life. It's true that most people experience some mild forgetfulness as they age, occasionally misplacing keys, or forgetting a name momentarily. However, we're talking about more serious changes. This could include frequently forgetting recent events or conversations, repeatedly asking the same questions, getting lost in familiar places, having trouble following directions or recipes, difficulty managing finances or medications, or experiencing confusion about time or place. These types of cognitive changes go beyond normal age-related forgetfulness and could be signs of mild cognitive impairment, MCI, or dementia, such as Alzheimer's disease. Other potential causes might include medication side effects, infections, like a urinary tract infection, which can cause sudden confusion in older adults, thyroid problems, vitamin deficiencies, especially B12, depression, or sleep deprivation. It's vital not to dismiss these changes. Early diagnosis of conditions like Alzheimer's allows for access to treatments that may help manage symptoms, as well as planning for future care and support. If you or a loved one are experiencing noticeable memory loss or confusion, please consult a doctor for a thorough evaluation. The fourth warning sign to be aware of is shortness of breath, especially if it occurs during rest or with minimal exertion. Feeling breathless after strenuous activity is normal, but finding it difficult to catch your breath while sitting, lying down, or doing light activities like walking across a room is a red flag. This symptom, medically known as dyspnea, can indicate problems with either the heart or the lungs. Potential heart-related causes include heart failure, where the heart isn't pumping efficiently, coronary artery disease, or heart rhythm problems, arrhythmias. Lung-related causes could involve conditions like chronic obstructive pulmonary disease, COPD, asthma, pneumonia, pulmonary embolism, a blood clot in the lungs, or interstitial lung disease. Anemia, low red blood cell count, can also cause shortness of breath because the body isn't getting enough oxygen. Sometimes anxiety can also manifest as breathlessness. Given the seriousness of potential underlying conditions affecting vital organs like the heart and lungs, shortness of breath that is new, persistent, or occurs with little effort should never be ignored. Seek medical evaluation promptly to determine the cause and receive appropriate treatment. Warning sign number 5 is persistent and overwhelming fatigue. We all feel tired from time to time, especially after a busy day or a poor night's sleep. But persistent fatigue is different. It's an extreme ongoing lack of energy and feeling of weariness that isn't relieved by rest or sleep. It can significantly impact your ability to perform daily activities and enjoy life. This kind of profound exhaustion can be a symptom of many underlying health issues common in older adults. Potential causes include anemia, thyroid problems, especially an underactive thyroid, heart disease, lung disease, diabetes, kidney or liver disease, infections, autoimmune disorders like rheumatoid arthritis, sleep disorders like sleep apnea, depression, or side effects from certain medications. Sometimes, poor nutrition or dehydration can also contribute. Because fatigue is such a non-specific symptom, meaning it can be caused by many different things, it's important to discuss it with your doctor if it's persistent and interfering with your life. They can review your symptoms, medical history, and medications, and order tests if necessary to identify the underlying cause. Don't just accept constant exhaustion as inevitable. It could be your body signaling that something needs attention. Our final warning sign involves sudden or significant changes in mood or behavior. This could manifest as persistent sadness, hopelessness, or crying spells, signs of depression, excessive worry, nervousness, or panic attacks, signs of anxiety, loss of interest in activities previously enjoyed, apathy, increased irritability or agitation, social withdrawal, or noticeable changes in personality. While experiencing ups and downs is part of life, marked and persistent shifts in emotional state are cause for concern. Mental health is just as important as physical health, and conditions like depression and anxiety are common in older adults, but often go unrecognized or untreated. They are not normal parts of aging. These mood changes can sometimes be linked to physical health problems, medication side effects, grief, social isolation, or neurological conditions. Untreated depression or anxiety can significantly impact quality of life, worsen physical health problems, and even increase the risk of cognitive decline. If you notice these changes in yourself or a loved one, it's crucial to seek help. Talk to your doctor, who can screen for depression and anxiety, review potential contributing factors, and recommend treatment options, which might include therapy, medication, or support groups. Prioritizing mental well-being is essential at every age. So, let's quickly recap the 6 key warning signs we've discussed today that should never be ignored after age 70. Unexplained weight loss, frequent falls or balance issues, significant memory loss or confusion, shortness of breath with minimal exertion, persistent fatigue, and sudden changes in mood or behavior. Recognizing these signs in yourself or a loved one is incredibly important. Please remember these symptoms are not necessarily just normal parts of getting older. They can be indicators of underlying health conditions that require medical attention. The key message is not to dismiss them or delay seeking help out of fear or embarrassment. Being proactive and talking to your doctor early can lead to timely diagnosis, effective treatment, and better management of your health, ultimately contributing to a better quality of life and potentially preventing more serious complications down the road. Listen to your body. It often knows when something isn't right. We hope this video has provided valuable information and encourages you to prioritize your health. If you found this helpful, please give it a like and subscribe to our channel for more content focused on healthy aging. Hit the bell icon so you don't miss out. Have you experienced any of these signs, or do you have advice for others? Share your thoughts respectfully in the comments below. Thank you for watching. Take good care of yourselves and seek help when you need it.